Fentanyl overdose, severe anoxic brain injury, and ICU. What are the options? My name is Patrik Hutzel from intensivecare.com, where we help families of critically ill patients in intensive care to make informed decisions, have peace of mind, control, power, and influence, even if you're not a doctor or a nurse in intensive care, so that your loved one always gets best care and treatment. In today's video, I want to answer a question from Heather, who writes, my daughter is 24 and had an overdose on fentanyl, and they found she had a severe anoxic brain damage to the basal ganglia area. She's been in ICU now for 3 weeks. She's got a tracheostomy and a PEG tube and is now breathing on her own with a tracheostomy mask. She's showing signs of alertness, like reactive pupils and posturing. As of now, she opens her eyes but doesn't respond intentionally. She also recently got a blood infection due to a PICC line that has been removed and is causing her fevers. The doctors say the fever could also be due to neurological issues. She's being given Precedex and oxycodone, as well as midazolam/Versed. No seizures have been found after the EEG, but MRI shows damage to the basal ganglia. They are talking about moving her to an LTAC, and I'm worried about the outcome. What can I do in this situation? This is from Heather. Obviously, Heather is in the US because she's talking about LTAC. LTAC is unique to the US. LTAC stands for long-term acute care hospital or long-term acute care facility. It's often where ICUs in the US want to move patients as soon as they've got a tracheostomy and a PEG tube. But let's break this down. First of all, Heather, I'm really sorry to hear about your daughter's situation. It is incredibly difficult. But let's also look at some positives here. Your daughter is only 24 years of age, which is a good prognostic factor when it comes to recovery from severe brain injury. She's breathing on her own with a tracheostomy mask, which shows she has respiratory drive and strength. Her pupils are reactive and she's opening her eyes. These are very encouraging signs. Now, there are a few important things to keep in mind. Number one, sedation and pain medications. She's on Precedex, which is also known as dexmedetomidine, Versed, which is also known as midazolam, and she's on oxycodone. All of those drugs suppress neurological function, so the ICU team can't truly assess her level of brain function until those medications are minimized or even stopped. That's really important to point out. Also, now that she's got a tracheostomy, all opiates and benzodiazepines should be stopped. So Versed, midazolam is a benzodiazepine and oxycodone is an opiate. All of that should be stopped, but even Precedex should be stopped. One of the main reasons someone has a tracheostomy is to stop all sedation and all opiates. So they're really defeating the purpose of having done the tracheostomy. What you see in ICU is not always what you get. If you don't know what to look for, if you don't know what questions to ask, you are fighting an uphill battle. The biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. Next, your daughter's fever. Yes, neurological fever is a possibility in brain-injured patients, but given that your daughter had a bloodstream infection from the PICC line, it's much more likely that the infection is still causing the fever. This needs aggressive treatment with antibiotics. Next, LTAC. This is where I want to caution you. LTACs, also known as long-term acute care facilities or long-term acute care hospitals, are often a step down from ICU, and the level of care is simply not the same. The level of care is simply dangerous. Many families regret moving their loved ones to LTAC. Alternatives exist, such as intensive care at home, and you can find more information at intensivecare.com, where patients can receive ICU-level care at home with 24/7 intensive care nurses. This is actually the best evidence-based approach for a situation like your daughter, and it's often a much better option, especially for young patients with long recovery potential. You can check out our service at intensivecare.com. Next, prognosis. Recovery from anoxic brain injury is a long process. It's not measured in days or weeks. It's measured in months and often years. Many young patients have surprised doctors by achieving far more than expected, but families often need to slow down the process, keep their loved ones safe, and give time for recovery. So what should you do? Insist on a proper neurological assessment of sedation, of opiates. Track her Glasgow Coma Scale regularly. Get early neurorehabilitation input. Do not rush into LTAC without understanding all implications. Explore intensive care at home as an alternative. I know, Heather, this is a lot to take in, but you are already doing the right things by asking the right questions and by seeking advice. If you're watching this and you have a loved one in intensive care with severe anoxic brain injury or any other critical illness, you need to help navigating this. Go to intensivcarehotline.com, call us on one of the numbers on the top of our website, or simply book a call with me on the top of the website, or simply send us an email to support@intensivcarehotline.com. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivcarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivcarehotline.com, and you can verify it on our intensivcarehotline.com podcast section where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivcarehotline.com, if you click on the membership link, or if you go to intensivcaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivcarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivcarehotline.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivcarehotline.com email newsletter at intensivcarehotline.com. Thank you so much for watching. This is Patrik Hutzel from intensivcarehotline.com, and I will talk to you in a few days. Take care for now.